Hello and welcome to Health Professional Radio. Thank you so much for joining us again. I'm your host, Neil Howard, and I'm going to be in conversation with returning guest, Dr. Suzanne Steinbaum. She's joining us to talk about managing high cholesterol with a busy schedule, a little bit about how statin therapy may be a critical part of achieving cholesterol goals, and that there are several statins available, but not all statins are the same. Welcome back, Dr. Steinbaum. Thanks for returning.
Thank you for having me.
Well, for our listeners who may not be familiar with you as a contributor, talk about, what it is you do and where it is that you do it there in NYC.
I am a preventive cardiologist with a specialty in women and heart health. I have run several programs of women and heart health in New York City at multiple different hospitals. I'm now in private practice and an author of Dr. Suzanne Steinbaum's heart book, Every Woman's Guide to a Heart Healthy Life. Mm-hmm. And I'm here in New York seeing people live, which is so exciting, but have been able to connect with people all over this country about getting heart healthy in this past year and a half, as it's been such a challenging time for everyone.
Absolutely, absolutely. Well, let's take it back a little bit and explain to us the difference between good cholesterol and bad cholesterol.
So bad cholesterol we call LDL. I always say L, the lousy, the lower, the better. Okay. HDL, happy cholesterol. Okay. H for happy, the higher, the better. And really the LDL, we know as it goes up in the bloodstream, increases the incidence of heart disease, heart attacks, and strokes. And the HDL is really protective and can protect your arteries from developing plaque and leading to these disease processes.
Now, most people try and control the cholesterol through diet, especially if you're a little bit older and understand, about the French fries and the hot dogs and things of that nature. But there are several drugs available, aren't there?
Yeah, I hope that most people try to change their diet because I think that is so important, and also exercise. And those two things sometimes can get cholesterol down, but oftentimes it is not enough. And that's when cholesterol medication, statins, are really the most protective for preventing heart disease and stroke. And sometimes those medications are the most important to start taking.
I have a little bit of experience with some troublesome cholesterol. I know that it's extremely challenging. Is managing cholesterol usually lead to the use of medication?
I have to say that as we get older, and for people who have had heart attacks or strokes in the past, people with diabetes or multiple other risk factors, high blood pressure, being overweight or obese, and we can't really forget family history. These sort of people will have a really hard time getting their cholesterol down just with diet and exercise. And I always tell everyone that the worst thing to do is to ignore it. You can't feel cholesterol. And it is really one of the greatest risk factors that leads to heart disease. So ignoring it isn't going to make things better. And that's when I think it becomes so important to just say, okay, I'm going to take a medication. I'm going to take a statin. And really having this conversation with your doctor is critical. Once your doctor puts you on a medication, if that's the case, and I want to just bring this up, 50% of people will stop that medication within the first year, which becomes incredibly scary, especially when many people don't tell their doctor that they're doing this. So communicating with your doctor, having an open dialogue about medication and whether or not it's right for you, and certainly if you intend to stop it for whatever reason, talking to your doctor is so important.
How busy is too busy to pay attention to changing your diet or even being compliant with a medication once it's prescribed? We all have busy lives, and that's just one more thing that adds to that to-do list.
I look at it differently. If you have to take a medication, it's very easy to just take the medication. It's a lot harder not to do it. And I think this busy lives concept that, all of us are leading these incredible hectic lives right now. And I think that it's important for us to realize our health is the primary priority. And if we don't put our health first, all these other things will never happen. We will get sick. We will not be able to take care of that checklist of to-dos. And so really taking a medication dieting, exercising. This is all we need to really focus on in order to live those busy lives.
Getting back to the statin therapy, we're managing with our busy lives, but the doctor keeps saying that, well, you've got a bit of a problem here, and I'm going to prescribe this, that, or the other. How does your physician know which statin to put you on?
So this is a really important question, and this is when the doctor and the patient have conversations. There are multiple different medications and multiple different statins. One of the statins, called LIVALO, is something that might be used for people with really complicated medical histories, like diabetes, and they're on multiple medications, and they're older, and LIVALO might be the perfect statin for that person. But there are other statins and many different kinds. And again, having that conversation with your doctor becomes important.
Heart disease is the leading cause of death for women here in the United States. Yet I understand that only about half of women who are talked about it or asked about it at all realize that heart disease is their number one killer. What about the awareness of symptoms, lifestyle?
Heart disease has been the number one killer of all women, more than all cancers combined, since 1984. And the awareness of heart disease in women have really been not so great. Anywhere between 30 and 50% of women know that heart disease is their number one health threat. Certain studies have shown higher, but we know that women of color and younger women who are at greater risk of heart disease right now than ever are not as aware. And so getting this information out is so important. And that also, as you mentioned, symptoms can be different in women. It's not necessarily that crushing chest pain that we think about with men. It could be more subtle, like shortness of breath, nausea, vomiting, jaw pain, back pain, even fatigue or flu-like symptoms. So I'm going to get back to what I keep saying, which is communicating with your doctor is important. If you are a woman who has risk factors, and let me say this first, you need to know your risk factors. You have to get your cholesterol checked and your blood pressure checked and your sugars checked. You have to know your family history. And so establishing a relationship with a healthcare provider to really go through these risk factors for you and to make a decision whether or not you need medication is the first step. I would like to also say this concept of communicating with your doctor is something that I think is challenging for some people. And knowing how to talk about medications and talk about their symptoms is challenging. There's a website, LIVALORx.com, which is a real good place to go for guidance to really determine the best ways to communicate with your doctor in terms of statins and understanding how to mitigate the risk of high cholesterol, which again is one of the greatest risks.
Where can we learn more about you, Dr. Steinbaum? And you have already given us a website where we can learn more about LIVALO. Give us a website where we can learn more about you and your publications as well.
You can find me at drsuzannesteinbaum.com. I also have an educational YouTube channel, Dr. Suzanne Steinbaum. And I believe that what we're doing here today is one of the most important things, which is education, and really to explain the importance of these risk factors, the importance of cholesterol, the importance of taking statins, and of course, the importance of communicating with your healthcare provider. Always
a pleasure, Suzanne. I'm hoping that we'll speak again. Thank you.
Thank you.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Suzanne Steinbaum. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.